I'm Dr. Luis Gavin. I'm from Spain, based in Dubai, oral maxillofacial surgeon. I'm very highly specialized in temporomandibular joint and also surgery and also arthroscopy. I work in King's College Hospital and Cargas Hospital. So the aim of this video is to explain a part of any actions we do inside the joint, also how my treatment is different because I combine the internal treatment with the external treatment. We're talking about the kinetics, we're talking about the mechanics, we're talking about the integration because the problems in this head, neck, jaw, and this joint are connected with the asymmetry of the face, with the position of the jaw, with the peculiarities of the joint, with the muscles all around, the clenching, the tension we provide when we chew, when we clench by ourselves. For that also it's critical, and this is my difference with others, I use this also external muscular component in my treatments. How? So this is combined along the treatment, because it's not only when I say, okay, you need treatment, go to the hospital, we need you under sedation, hospital, inside. But it's combined with, at the same time, inside the operation room, but it's not an operation, but we say in hospitals, we say operation room, let's say under sedation or under general anesthesia. General anesthesia, why? Because we need to relax all muscles. Because the first I have to do, I have to realign, I have to recenter, I have to reposition with my hands. I go inside like this, and I have to do some exercises to move back to regular position your jaw. And this impact this position, this wrong position of the jaw, back and up. Then after, we have to provide also some Botox. So many people, they use Botox, but Botox has to be with a sense. You know why you use it, amount, where, why, they are critical things. Okay, use Botox, yes, but Botox, many people, they offer you only Botox. No, Botox by itself is nothing. It's like you have a car and you need how to drive the car. So it's the same. Botox is a complement to relax, fine. Then after also we use some high-tech instruments to provide, let's say, kind of waves or electricity to the muscles. It's not exactly electricity, but it's difficult to explain to you. Let's say waves, okay, the same, to relax the muscle. Then after, more you are relaxed, more I can work, more I can reposition, more I can repair everything in the outside again and the inside of the joint. Then finally also, I had to use this kind of guidance because people, they go, but you have to be guided. With this kind of guidance, we prepare inside, and that provides me the information where I have to position you. Then after, I use also these kind of blocks. I use for myself here as an example. Then automatically we can push down the jaw, what no any human can do by himself. That splints to, again, to this stretch, decompress the push up of the jaw here in the ear and in the joint and relax, stretch the muscles. And also we use this splint. This is to force the position to pull forward the jaw. It's like a key, something passive exercises, something like that. Huh? So then the same, we mobilize. These joints are for so long time never move because of the pain, because of the dislocation, because even so many people are afraid because they lose confidence in their own anatomy, in their own body, in their own joint. Finally, after the treatment, this alone the treatment, or immediately after the treatment, the hospital treatment. We're talking about hospital treatment. Do not be confused with small clinics treatments. Maybe because of the expertise of the doctor, maybe because of the knowledge of the doctor, maybe very important because they don't have the technology, and maybe because, of course, they cannot do any sedation or any general anesthesia. So they are treatments that are only privative, they only alone and correspond to hospital. So you have to differentiate what is hospital, high-level, high-tech treatment, and regular clinics, small street treatment level. Then after, I invent, because if I do nothing, after you, maybe you go back to problems. I'm not going to change your face, your asymmetry, your bite, even if you clench. How can I control that? I cannot control. So I invent this dispositive. It's a double system, upper-lower splint, to be used only in the night like a compensation. You cannot clench, and also observe thanks to the hinge, we can pull the jaw in millimeters down and forward. Day after, you go back to normal, but at least it's a compensation. Imagine you have one leg longer than other. What do you use? A heel. But the difference is the heel is in the day for the legs. Here we're talking about the night. It's comfortable procedure, and I give you the proof myself. I use myself. It's comfortable. I can speak. I can do anything I want. And even, sorry to say, observe how it looks like the color, because I use it myself from so many years. So that could be, we use so many years. Why? Because the people, they feel better after when they use in the wake up. They feel no tension, they don't clench, they sleep better, very critical, because also not many of you, they know that all these components, all these problems affect your sleep. But you get used. I think, okay, my sleep is good, but it's not good. We analyze the quality of the sleep. Well, thank you so much for coming here and watching me. Thank you.